Gentlemen, I'm Dr. Shalene Jomis, and I've been a practicing urologist and men's health specialist for over 23 years. In that time, I've helped thousands of men over 60 rediscover something they thought was lost forever: the ability to truly satisfy their wives in the bedroom, not just for a few minutes, but with the control, stamina, and intensity they had decades ago. Now, if you're watching this video, chances are you've noticed changes. Maybe you're not lasting as long as you used to. Perhaps the intensity isn't what it once was. Or maybe you're dealing with that frustrating lack of control that leaves both of you disappointed. I want you to know something right now. This is not your fault, and more importantly, it doesn't have to be this way. I'm sharing this with you today because I believe every man deserves to feel confident and capable in his marriage, regardless of age. What I'm about to show you is a specific pelvic floor exercise that has changed the love lives of my patients, men just like you who thought their best years were behind them. This isn't about pills, pumps, or anything artificial. This is about retraining a muscle system you didn't even know you had and using it to transform your intimate relationship with your wife. Stay with me for the next few minutes because what I'm about to share could be the missing piece you've been searching for. The reality of aging and intimacy. Let me be completely honest with you. As a urologist who specializes in men over 60, I see the same pattern almost every single day in my practice. A man comes into my office, usually after his wife has encouraged him, sometimes after months of him avoiding the conversation. He sits down, looks at the floor, and tells me something like, "Doc, things just aren't working like they used to." Here's what's actually happening in your body, and why understanding this is the first step toward fixing it. As we age past 60, several natural changes occur simultaneously. Your testosterone levels decline, not dramatically overnight, but gradually, about 1 to 2% each year after age 30. By the time you reach 65, you might have 30 to 40% less testosterone than you did at your peak. But testosterone is only part of the story. The real issue that affects your performance in the bedroom involves something called the pelvic floor muscles. These are the muscles that surround and support your bladder, bowel, and all the structures involved in intimate function. Think of them as a hammock of muscle tissue that runs from your pubic bone to your tailbone. When you're younger, these muscles are naturally strong and responsive. They contract automatically during intimate moments, helping you maintain firmness, control when you climax, and even intensify the sensation for both you and your wife. But after decades of sitting, lack of specific exercise, and natural aging, these muscles become weak, sometimes losing up to 50 to 60% of their original strength by age 70. I had a patient named Thomas, 68 years old, married 42 years to his high school sweetheart. He came to me absolutely devastated. He told me, "Dr. Jomis, I can't even look my wife in the eyes anymore. We used to have such a passionate connection, and now I'm lucky if I last 3 minutes. She tells me it's okay, but I can see the disappointment. I feel like I'm failing her as a husband." This broke my heart because I knew Thomas wasn't failing anyone. His body had simply never been taught how to maintain these critical muscles, and the emotional toll. That's what really concerns me as a physician. When intimacy suffers, marriages suffer. Studies show that couples over 60 who maintain satisfying intimate lives report significantly higher overall relationship satisfaction, better communication, and even improved physical health. The loss of stamina, the inability to control your timing, the decreased intensity, these aren't just physical problems. They affect your confidence, your sense of masculinity, and the emotional connection you share with your wife. Many of the men I treat tell me they've started avoiding intimate situations entirely because they're embarrassed. They'd rather make excuses than face another disappointing encounter. But here's what I want you to understand. Your body is designed to remain functional well into your 70s, 80s, and beyond. The equipment works. What's missing is the muscular control and blood flow optimization that you had naturally as a younger man. And that can be retrained, gentlemen. That can absolutely be retrained. Why pills and quick fixes fail you. Now, I know many of you have tried other solutions. You've probably seen the commercials. The ones with the happy couples walking on the beach, holding hands, looking 20 years younger than they actually are. The little blue pill. The daily medications. The supplements promising instant male enhancement. Let me tell you what these actually do, and more importantly, what they don't do. Medications like Viagra and Cialis work by increasing blood flow temporarily, usually for 4 to 6 hours. They can help you achieve firmness, yes, but they do absolutely nothing for your stamina or control. I've had countless patients tell me, "Doc, the pill works to get things going, but I'm still finishing in 2 minutes. My wife is left unsatisfied, and now I'm just frustrated and out $60. These medications also come with side effects that become more problematic as we age: headaches, facial flushing, visual disturbances, and in some cases, dangerous interactions with heart medications. If you're taking nitrates for chest pain, these pills can actually be life-threatening. Then there are the natural supplements. I see advertisements everywhere promising that some exotic herb or mineral will restore your performance naturally. Gentlemen, I want to be very clear about this. The supplement industry is largely unregulated. Most of these products contain either ineffective doses of their advertised ingredients, or worse, they're contaminated with actual pharmaceutical compounds that aren't listed on the label. I had a patient named Vincent, 71, who spent over $3,000 in 1 year on various supplements he found online. Not a single one made any measurable difference in his performance. When he finally came to see me, he was demoralized and convinced nothing would ever work. Here's the fundamental problem with all these quick fixes. They're treating symptoms, not causes. They're trying to artificially inflate your body's response without addressing the underlying weakness in your pelvic floor muscles and the poor blood flow patterns that have developed over years of neglect. Think about it this way. If your car's engine is weak, you wouldn't just keep pressing the gas pedal harder and hoping for better performance. You'd tune the engine. You'd make it stronger at its core. That's exactly what we need to do with your intimate function. The approach I'm going to teach you today doesn't cost anything. It has 0 side effects. It doesn't just mask the problem temporarily. It actually rebuilds your natural function from the foundation up. And the best part? Once you develop this strength and control, it stays with you. You're not dependent on a pill timed perfectly before intimacy. You're in command of your own body again. The big reveal. The reverse Kegel pelvic floor. Reset. All right, gentlemen, this is the moment you've been waiting for. I'm going to introduce you to what I call the reverse Kegel pelvic floor reset. This is the specific exercise that has transformed the intimate lives of hundreds of my patients, over 60. Now, you may have heard of Kegel exercises before. Traditional Kegels involve contracting or squeezing your pelvic floor muscles. The same muscles you use when you stop urination midstream. Those exercises have their place, certainly, but for men over 60 struggling with premature climax and lack of stamina, traditional Kegels actually make the problem worse. Here's why. When your pelvic floor is chronically tense from years of stress, poor posture, and inadequate exercise, adding more tension through traditional Kegels is like tightening an already overwound spring. What you need instead is to learn how to relax and lengthen these muscles on command, creating what we call reverse Kegels, and then combine this with strategic strengthening at precisely the right moments. The reverse Kegel pelvic floor. Reset is a 3-phase exercise protocol that I've developed specifically for men in your age group. It addresses the exact physiological issues that are robbing you of control and stamina in the bedroom. Phase 1 is learning to actively relax your pelvic floor. This is the reverse Kegel. Instead of squeezing and lifting, you're gently bearing down and releasing, as if you're starting to urinate, but without actually doing so. This releases chronic tension and dramatically improves blood flow to the entire pelvic region. Phase 2 involves rhythmic contraction relaxation patterns that retrain your neuromuscular control. This is where you develop the ability to prevent early climax by consciously controlling the reflex that triggers it. Phase 3 integrates breathwork and visualization techniques that optimize your parasympathetic nervous system, the part of your nervous system responsible for sustained arousal and performance. When I first taught this to Thomas, the patient I mentioned earlier who was struggling after 42 years of marriage, he was skeptical. He said, "Doc, you're telling me that breathing and relaxing some muscles I can barely feel is going to fix my problem." I told him, "Trust me and give it 2 weeks of daily practice." 3 weeks later, Thomas returned to my office with tears in his eyes. He told me that he and his wife had reconnected intimately in a way they hadn't experienced in over a decade. He was lasting 20 to 30 minutes comfortably, with complete control over his timing. But more than that, he said the emotional intimacy had returned to their marriage. They were laughing together again, touching spontaneously, feeling that spark they thought was gone forever. This is what's possible when you address the root cause instead of chasing quick fixes. Now let me explain exactly why this works at a physiological level, the science, why this actually works. As a urologist, I'm going to give you the scientific foundation for why the reverse Kegel pelvic floor reset is so effective. Understanding this will help you trust the process and stay consistent with your practice. First, let's talk about blood flow. When you achieve and maintain firmness during intimacy, you're relying on a hydraulic system. Blood flows into the erectile tissue and becomes trapped there by the contraction of specific muscles. But here's the critical part that most men don't understand. Chronically tight pelvic floor muscles actually restrict this blood flow. It's like trying to fill a water balloon while someone is squeezing the opening. When you practice reverse Kegels, actively relaxing and lengthening your pelvic floor, you're opening up the vascular pathways. Studies using Doppler ultrasound have shown that men who practice pelvic floor relaxation exercises demonstrate up to 43% improvement in arterial blood flow to the genital region within just 4 weeks. Think of it like unclogging a pipe. Once the restriction is removed, blood flows freely, and you can achieve and maintain firmness much more easily without any pharmaceutical assistance. Second, let's discuss neuromuscular control and the ejaculatory reflex. When you climax, it's triggered by a reflex arc, an automatic response that travels from your genital nerves to your spinal cord and back. In younger men, this reflex has a higher threshold, meaning it takes more stimulation to trigger it. As you age, this threshold lowers, which is why you may find yourself finishing much more quickly than you used to. The rhythmic contraction relaxation patterns in Phase 2 of the reset actually retrain this reflex arc. You're teaching your nervous system to require more intense or prolonged stimulation before triggering climax. It's neuroplasticity in action, the same principle that allows stroke patients to regain movement through repetitive exercises. I explain it to my patients like this. Imagine your ejaculatory reflex is a light switch that's become overly sensitive. The slightest touch, and it flips on. What we're doing with this exercise is essentially moving that switch further away, so it takes more deliberate action to activate it. After several weeks of practice, you'll have conscious control over when and if you allow that reflex to complete. Third, there's the hormonal cascade. When you engage in the breathwork and relaxation component of Phase 3, you're activating your parasympathetic nervous system, the rest and digest system. This has profound effects on your hormone balance during intimate moments. Specifically, you're increasing dopamine and oxytocin while simultaneously reducing cortisol and adrenaline. Dopamine enhances pleasure and motivation. Oxytocin deepens emotional connection and bonding, not just for you, but for your wife as well when you're intimate together. Meanwhile, cortisol and adrenaline are stress hormones that interfere with sustained arousal and performance. I had a patient named David, 69, who had been experiencing performance anxiety so severe that he could barely maintain firmness long enough for penetration. He'd get started. His mind would race with worry, and everything would shut down. When I taught him the breathing component of the reset, it completely changed his experience. He told me, "Dr. Jomas, it's like a switch flipped in my brain. Instead of panicking, I breathe, I relax my pelvic floor, and suddenly I'm present in the moment with my wife. The anxiety disappears, and my body responds naturally." David went from erectile dysfunction to confident, satisfying intimacy in less than 3 weeks. Fourth, let's talk about the intensity factor. When your pelvic floor muscles are properly trained, both strong and flexible, they contract more powerfully during climax. This creates significantly more intense sensations for you. But here's what's really important. It also creates better stimulation for your wife. The pelvic floor muscles control the rhythmic contractions during climax and also influence your rigidity during intimacy. Stronger, more controlled muscles mean better overall experience for both of you. It's not just about lasting longer, it's about the quality of the entire intimate encounter. Finally, there's the circulation and oxygenation benefit. The combination of increased blood flow and controlled breathing means your genital tissues are receiving optimal oxygen and nutrients. Over time, this actually improves the health of the tissue itself. Better sensitivity, better responsiveness, better function across the board. This is why the reverse Kegel pelvic floor reset works when pills and supplements fail. You're not artificially forcing your body to respond. You're restoring your body's natural, optimal function through targeted exercise and neurological retraining. You're rebuilding from the foundation up. Step-by-step instructions. How to perform the reset. All right, gentlemen. Now I'm going to walk you through exactly how to perform the reverse Kegel pelvic floor reset. I want you to follow these instructions precisely and commit to practicing daily for at least 2 weeks before you judge the results. Phase 1. Learning the reverse Kegel. Find a private, comfortable space where you can sit or lie down without distraction. I recommend starting while lying on your back with your knees bent and feet flat. First, locate your pelvic floor muscles by imagining you're trying to stop urination midstream. Feel that gentle squeeze and lift? Good. Now do the exact opposite. Instead of squeezing and lifting, you're going to gently bear down and relax, as if you're starting to urinate or pass gas. But very gently. Don't actually do it. Just engage those muscles in that direction. You should feel a subtle dropping or releasing sensation in your pelvic floor. Your lower abdomen may expand slightly. This is correct. Hold this gentle release for 5 seconds. Breathing normally, then relax completely for 5 seconds. Repeat this 10 times. This is 1 set. Common mistake to avoid. Don't hold your breath, and don't bear down so hard that you're straining. This should feel like a gentle release, not a forceful push. Phase 2. Rhythmic control training. Once you're comfortable with the reverse Kegel, we add the control component. You're going to alternate between a standard Kegel contraction and a reverse Kegel relaxation in rhythm. Contract your pelvic floor, squeeze and lift for 3 seconds, then immediately reverse Kegel, relax and release for 5 seconds. The key here is the smooth transition and the longer relaxation phase. Repeat this pattern 15 times. This is 1 set. Practice this twice daily, studies morning and evening. This phase is specifically training your neuromuscular control over the ejaculatory reflex. Phase 3. Integration with breathwork. This is where everything comes together. You're going to perform your rhythmic control training while coordinating with deep, slow breathing. As you contract your pelvic floor, Kegel, breathe in slowly through your nose for 3 counts. As you reverse Kegel, relax. Breathe out slowly through your mouth for 5 counts. Repeat this breathing muscle coordination for 10 cycles. While you're doing this, I want you to visualize increased blood flow and relaxation spreading through your entire pelvic region. This might sound mystical, but visualization actually activates the same neural pathways as physical action. It enhances the effectiveness significantly. Do this complete 3-phase sequence once in the morning and once in the evening. Each full session takes about 8 to 10 minutes. That's your entire daily commitment. Less time than you spend checking your phone in the morning. After 2 weeks of daily practice, you'll begin incorporating this control during actual, intimate moments. When you feel yourself approaching climax too quickly, you'll consciously perform a reverse kegel, that gentle relaxation and release, while taking a slow, deep breath. This interrupts the ejaculatory reflex and allows you to continue. With continued practice, this becomes automatic. You won't even have to think about it. Your body will naturally maintain control, allowing you to decide when you're ready to finish rather than it being decided for you. Results and timeline. What to expect now? Let me tell you what you can realistically expect as you practice the reverse Kegel pelvic floor reset consistently. Within the first 3 days, you'll begin to develop awareness of your pelvic floor muscles that you probably didn't have before. Many men tell me they had no idea these muscles even existed. This awareness itself is valuable. You're reconnecting with your body. By the end of week 1, you should notice improved blood flow and easier achievement of firmness, even without intimate contact. Your morning firmness may return or become stronger than it's been in years. This is your body responding to the improved circulation. By the end of week 2, this is when most men experience their first breakthrough during actual intimacy. You'll find you have significantly more control over your timing. Where you might have lasted 3 to 5 minutes before, you're now lasting 10 to 15 minutes comfortably. The anxiety that may have accompanied intimacy begins to fade because you trust your body again. By the end of week 4, your control becomes natural and effortless. You're consistently lasting 20 to 30 minutes or more, and the intensity for both you and your wife has noticeably improved. Many of my patients report that their wives comment on the difference. The sustained firmness, the confident rhythm, the emotional presence. I had a patient named Richard, 72, who came back for his 1-month follow-up appointment and told me something that still makes me smile. He said, "Dr. Jomas, my wife pulled me aside last week and asked what I've been doing differently. She said it's like the clock turned back 20 years. We're intimate 3, sometimes 4 times a week now, and she's initiating more than I am." By month 3, the benefits become your new normal. Your pelvic floor strength and control are fully restored. You have complete confidence in your ability to satisfy your wife. The emotional intimacy in your marriage deepens because you've removed that source of frustration and embarrassment. But here's something else that many men don't expect. The health benefits extend beyond the bedroom. Better pelvic floor control means better bladder control. You might find yourself getting up less frequently at night to urinate. Your posture may improve because these muscles support your lower back. Some men even report less lower back pain. The timeline I've described is typical, but remember, every man is different. Some respond faster, some take a bit longer. The key is consistency. Don't skip days. Don't get frustrated if progress seems slow at first. Trust the process, and your body will respond. Bonus tips and warnings. Before we wrap up, I want to share a few additional tips that will enhance your results and help you avoid common mistakes. Bonus tip 1. Hydration. Proper hydration is critical for optimal blood flow. I recommend drinking at least 8 glasses of water daily. Dehydration thickens your blood and reduces circulation efficiency. Many of my patients notice improved firmness and stamina simply by increasing their water intake alongside the pelvic floor exercises. Bonus tip 2. Limit alcohol. Before intimacy, I know many couples enjoy a glass of wine with dinner, and that's perfectly fine. But more than 1 or 2 drinks before intimate time will significantly impair your nervous system's ability to maintain control and arousal. Alcohol is a depressant. It slows neural signaling, reduces testosterone temporarily, and interferes with the precise control you're developing through the reset. Bonus tip 3. Strategic timing. Practice your reset exercises in the morning, or at least 4 to 6 hours before you anticipate being intimate. This allows your muscles to be primed but not fatigued. You want them ready to perform, not exhausted from a recent workout. Warning 1. Don't overdo. Traditional kegels. Some men get enthusiastic and think, if this works, I'll just do hundreds of kegels throughout the day. Please don't. Over-contracting your pelvic floor without adequate relaxation will create the chronic tension we're trying to release. Stick to the prescribed protocol, the reverse kegels and rhythmic patterns I've outlined. Warning 2. Be patient with your body. If you've been struggling with these issues for years, don't expect overnight transformation. Your body needs time to relearn these patterns. Frustration and impatience will only create performance anxiety. Trust the process, celebrate small improvements, and know that cumulative progress is happening even when you can't feel it day to day. Warning 3. Communicate with your wife. Let your wife know you're working on improving your intimate connection. She doesn't need to know all the details if you're not comfortable sharing, but letting her know you're committed to your relationship and addressing this will strengthen your emotional bond. Many times, the anxiety men feel is worsened by hiding the problem. Bringing it into the light removes its power over you. I remember Vincent, the patient who had spent thousands on supplements, telling me that the most important thing he did was finally talking honestly with his wife about his struggles. She was incredibly supportive, and that emotional safety allowed him to practice the reset without pressure, which accelerated his results dramatically. Conclusion and call to action. Gentlemen, we've covered a lot today, so let me summarize the most important points. You don't have to accept declining intimacy as an inevitable part of aging. The control, stamina, and intensity you had in your younger years can be restored naturally through the reverse Kegel pelvic floor reset, a simple 3-phase exercise protocol that takes just 10 minutes twice daily. This approach works because it addresses the root cause: weakened, chronically tense pelvic floor muscles and restricted blood flow. By learning to actively relax these muscles, training rhythmic neuromuscular control, and integrating breath work, you're rebuilding your natural function from the foundation. Pills mask symptoms temporarily and cost you money. This exercise costs nothing, has 0 side effects, and creates lasting change. In 2 weeks, you can experience dramatically improved control and stamina. In a month, you can restore the passionate connection you thought was lost forever. I've shared this technique with hundreds of men just like you, men in their 60s, 70s, and beyond who refused to accept that their intimate lives were over. Men like Thomas, who reconnected with his wife after 42 years of marriage. Men like Richard, who at 72 is intimate with his wife 3 to 4 times a week and loving every minute. You can be next. Tonight, when you're lying in bed, take 8 minutes and go through the complete 3-phase reset protocol. Tomorrow morning, do it again. Commit to 2 weeks of daily practice and see what happens. I'm confident you'll experience results that surprise and delight both you and your wife. Your wife deserves the passionate, present, confident man she fell in love with, and you deserve to feel capable and proud of your intimate relationship. This exercise can give that back to you. If this video has given you hope, if you're ready to try the reverse Kegel pelvic floor reset and surprise your wife tonight, do me a favor. Hit that like button so other men in your situation can find this information. Subscribe to this channel because I'll continue sharing discreet, effective men's health techniques that can change your life. And leave a comment below saying, "I'm trying this for her." Let me know you're committed to your marriage and to reclaiming your intimate confidence. As a urologist who has dedicated his career to helping men over 60 live their best lives, I'm honored to share this knowledge with you. I believe in you, and I believe in the power of your commitment to your wife and your marriage. Now go practice the reset. Your wife is going to love the results.